My name is Dr. Vijay Mule. I am from Vaticanol, India. I take opportunity to welcome you all on Vaticanol India virtual interaction platform. The name of this program is Veterinary Experts Speak. This is a digital initiative designed for sharing latest technical knowledge and updates related to the veterinary field from expert point of view. I would like to thank all the registered participants who have joined this webinar uh, uh, for this particular webinar. Having said that, today's topic of webinar is practical approach of fluid therapy in veterinary clinical practice of ruminant. As you are aware that fluid therapy is an important and life-saving treatment applied in day-to-day veterinary practice. The purpose of fluid therapy is to correct the dehydration and electrolyte imbalance. Then, during our customer interaction in the field, we observed that field veterinarians are keen to understand the information related to pathophysiology of dehydration, electrolyte imbalance in case of the farm animals. Also, they are keen to know about the assessment of the degree of dehydration as per the skin retention test and calculation of the fluid electrolyte deficit according to the degrees of the dehydration. So now at this virtual platform, let us understand this topic from the expert point of view. It gives me immense pleasure to introduce our today's speaker for the program, who is eminent scientist and versatile personality in the field of veterinary pharmacology. He is Dr. Sridhar NB, who is presently working as professor and head of veterinary pharmacology. I would like to thank Dr. Sridhar for accepting our request as a guest speaker for today's webinar. And now I would like to take you his short profile and some of his credentials. Dr. Sridhar graduated from University of Agriculture, Dharwad. He did his BVSc from Dharwad in 1990. He did his post-graduation MVSc in Veterinary Pharmacology and Toxicology from IVRI Izzatnagar in 1993. And he did his PhD in 2004 from Bangalore Veterinary College. He is expert in the field of veterinary pharmacology and toxicology and having more than 30 years of the experience in the relevant field. His professional career started as a veterinary officer in Karnataka Animal Husbandry Department, where he worked for 13 years. After that, due to his interest in teaching and research activity, he joined university services, that is Karnataka Veterinary and Animal Science Fishery University, as an assistant professor. Thereafter, he elevated as an associate professor in 2012, and presently he is holding the position of professor and head. He guided 26 MUSC students and 6 PhD students so far, and he is a member of advisory committee for several PG and PhD research projects. Dr. Sridhar has published more than 75 articles in the journals and also presented more than 120 papers in scientific conferences. He also written 4 books in Kannada, and he regularly writes Kannada articles in daily newspapers for the benefit of the farmer. Dr. Sridhar also handled various projects related to the veterinary sciences, and he is working as a principal investigator for 8 extramural projects. By virtue of his contribution in academic research and training and extension activity in the field, he was also awarded as Fellow of Academy of Science for Animal Welfare. He also received gold medal for highest CGPA in PhD in Bangalore Veterinary College. He also received Best Veterinarian Award from Karnataka Veterinary Association, and he also received Best Paper Presentation Award from ISVP, that is Indian Society of Veterinary Pharmacology and Toxicology. So there are several awards and credentials on Dr. Sridhar's name, and I take opportunity again from all the participants to welcome Dr. Sridhar for this today's webinar. And I call upon Dr. Sridhar to deliver his presentation on the topic, that is practical approach of fluid therapy in veterinary clinical practice. Over to you, Dr. Sridhar.
Thank you very much, my dearest friend, Mr. Vijay. And of course, I am extremely happy to participate in the Petokinals, this arranged, especially this particular very important topic. That's also the practical approach to the fluid therapy, especially in the feed conditions, and with a special reference to the ruminants, because many times we neglect the rehydration therapy whenever the animal undergoes the dehydration, and we will neglect such thing, and we will the animal succumbs to death. Hence, in this occasion, which is also very important point, and especially Dr. Sachin Raut and especially then Amit Karmakar and Vijay Gulia especially. So with this brief thanking remark, I will go ahead with the particularly this seminar is concerned. Yes.
Dr. Sridhar, you are not audible. You need to unmute.
Yes, I think he's fixing the audio issue.
Now am I audible?
Yes, sir. Yes, sir.
Yes, yes. Okay. So renal system, of course, one of the important system of the body, which is very important for the maintenance of the fluid and electrolyte balance. And the kidney has different functions, the basic thing is we need to know about the glomerular filtration, and water and small solutes are going to be filtered in the Bowman's capsule, as we have seen in the right side of this particular picture. And the most of 90% of them are reabsorbed into the capillaries once again. And there is renin angiotensin and aldosterone system is there, which is maintaining the control of this glomerular filtration, and renal blood flow system is very much required. And this is the a chart requiring about the fluid and water balance, especially in case of a adult human being. Of course, we can directly correlate this to the total, especially to the ruminants. Whereas the average total intake of the fluid is 2,500 ml in the adult human being. Of course, the water from the metabolism is from 250 ml, and what we drink or the animal drink, the maximum part is about 60% is the water. And from the food also do contain the especially the liquids, and the metabolic water generated is 250 ml. This is a rough figure, especially of a human being. Of course, in here the feces 4% excretion is there, then sweat 8%, and insensible these losses via the skin and lungs, of course, the sweat. Then the urine maximum output of the water is there. And of course, the fecal content is less than 4%, but if it increases whenever there is a diarrhea is concerned. Hence, the proximal convoluted tubule is having the capacity to reabsorb as ultrafiltrate here. Then it absorbs almost all the glucose, bicarbonate ions, and other metabolites, as we now, especially in the loop of the Henle's, then most of the water is absorbed back into the circulation. And of course, this distal convoluted tubule also absorbs sodium and chloride, and hence it is an important part. So here you can see that in different parts of the nephron, you can see that the water is absorbed back into the system.
Sir, can you speak little loudly because we are receiving the in the chat box that little audio need to be increased. Yes.
Okay, I will increase
Yes.
this
Please.
volume. Okay. I will surely so. So the proximal convoluted tubule, distal convoluted tubule, Henle's assembly of this ascending thick of the Henle, all these are making the contribution for the water reabsorption into the body, and collecting the ultimately collects and it lets the urine out of the body. So it's a balance between the input and output of the total water and electrolytes. It's essential for the it is required for the homeostasis or the balance in the body. And whenever the water is one of the most important component of the body of almost all the animals, and urine is the outproduct of many of the times the metabolism, and the initially the fluids are very much required as a solvent, as a transport vehicles, and the heat buffer, coolants, and many more functions as a waters or the electronic solvents, electrol solvents. And water is present in almost all the cells and intracellular fluid, and surrounds them as the extracellular fluids. It provides a constant and environment for the cells of the body. So the average fluid intake in a human being is 2.5 liter, and out of this 2.5 liters, about 1 liter is secreted as the urine. And the deficit of the water will be there whenever this system is totally hampered. And we know that in case of the human beings, and of course in case of the large ruminants, the water intake is about 75 to 100 liters depending upon the season. And the water is supplied by the food, the beverages, of course in case of the ruminants, it is about the water intake is by the owner which he feeds, and also the excretion of the water is in species, then the respiration, and also through urine. And the salt deficit also causes the decrease in the osmolality, decrease in the antidiuretic hormone, then water diuresis occurs, then the plasma volume decreases and blood pressure is going to decrease. And this activates the renin angiotensin system, and there will be increased thirst. So that this is going to activate the angiotensin 2, then this is going to activate the aldosterone. And because of this thing, sodium reabsorption from the kidney takes place. And also, whenever there is the excess salt, the opposite action is going to be mediated. That's how it goes. And the 0.35% of the total body weight is intracellular fluid. Here you can see this is the intracellular fluid, and 0.25% is extracellular fluid, or it's also called as the interstitial fluid. And most of the body's supply of the sodium ions are located in the extracellular components. So hence these are all, the kidney is the major regulator of the water and electrolyte balance. Of course, this is one of the most important organ. Whenever there is a kidney problem, then we can see that there is a water and electrolyte deficiency or imbalance. And the fluid volume deficit occurs due to the hemorrhage, vomiting, diarrhea, burns, diuretic therapy, fever, and impaired thirst. Of course, the vomiting is not so prominent in case of the ruminants are concerned. What we can say is regurgitation in case of the ruminants, whereas the hemorrhages and diarrhea, and sometimes the burns and overdose of the diuretic will cause lot of impairment, especially the fluid and electrolyte impairment is there. And the fluid management is containing so many type of the ingredients, especially the dietary therapy. Diet therapy, mild to moderate dehydration can be controlled by the diet correction, and correct with oral fluid replacement can be done. Whereas oral rehydration therapy is another therapy. Of course, it's very common in case of the human beings. And IV therapy is very important, especially to save the life of the animal. It is especially in case of this 8 to 15 grams of the sodium chloride are absorbed every day. The kidneys have to excrete the same amount, and whenever excreting this huge quantity of the salts, the water is also get excreted out. And this system is regulated by renin-angiotensin system, etiropeptin, pressure diuresis, and salt excess or the salt deficit. And RAS system also plays an important role, especially then whenever there is an increase in the potassium concentration in the blood plasma, then renin-angiotensin mechanism get activated, adrenal cortex, then the aldosterone is released, then it is going to act on the kidney tubules, then it is going to increase the sodium reabsorption and the potassium secretion is increased. And because of this thing, homeostatic plasma levels of sodium and potassium, they are going to be happen. Once again, this is whenever there is a negative effect or the regulation of this, especially this particularly the water and electrolyte balance is also one of the important this thing, especially directly the sodium and the reabsorption, water balance, and the blood pressure. They are all interrelated due to so many complex mechanisms, maybe the hypothalamus, adrenal cortex, and the extragranular apparatus, and many more. So they are going to either increase or decrease in the blood pressure. And of course, multiple type of these hormones, then also certain enzymes, then certain materials are involved in the fluid and electrolyte balance. And sometimes the diuresis is caused because of the osmotic pressure, because of the extracellular fluid volume, and salt excess also causes the same thing. Then the potassium imbalance or the balance will also happen whenever there is a fluid and electrolyte imbalance occurs, and we need to administer the potassium through the liquid or the fluid whenever it is excreted out. Of course, the sodium, potassium, calcium, and also the magnesium, all these are important. And we need to administer sometimes some solutions or sometimes these percent solutions. So the next topic I'm going to tell about what say normal saline, what say hypertonic saline, or what is say osmotic saline. All these things need to be solved. And of course, if we want to get 1% sodium chloride, we need to get 1 gram of sodium chloride in 100 ml. Or if you want to have 0.9% sodium chloride, then 900 milligram of the sodium chloride need to be administered or dissolved in 100 ml of the water. Then normality or normal solutions means many times we say, then they say that it is equivalent to molecular weight per valence of a solution. For example, if we take the sodium and chloride, it is equal to the one normal sodium chloride is 58.95 normal this grams of the sodium chloride per liter of the water. So molarity is also very molecular weight of a particular liquid need to be presented. So osmosis and osmotic pressure is also important in case of this fluid and electrolyte balance, and water deficit is by sweating, urination, and respiration. Mainly the urination is important thing, and water excess also reduces the osmolality. Then many times this renin-angiotensin system and other type of the systems are very important, and the tonicity of a cell is need to be maintained for the proper maintenance of the cell structure, etc. And so many type of the solutions, we will come back to the data. That's the isotonic solution, hypotonic solution, hypertonic solution, and isomotic solution, hypoosmotic solution, and hyperosmotic solutions. So here you can see that a hypotonic solution means the cells will swell, whereas the isotonic solutions, the RBC, suppose they are put, then they will retain their original topography. Whereas if it is a hypertonic solution or too much saturated solution, then the cells will shrink accordingly. So whenever there is a what you call as if you take the suppose there is a liquid or any other liquid, then decreased volume is retained by the suppose if it's put in a beaker, then total volume decreases less, and increased osmolality will distribute more and more ions here, whereas the decreased this osmolality is also going to cause less number of the ions. Then isotonic solution, in which the solute concentration is same as the solute concentration of another solution. The example is 0.9% sodium chloride and 5% dextrose. Hypotonic means the concentration is very less. Solution has the osmotic pressure lesser than that of the extracellular fluid. Hypertonic means the concentration is more. Solution has osmotic pressure greater than that of the extracellular fluid. So all other things, once again, we will discuss when we actually discuss about the fluid and electrolyte therapy. So objectives of the fluid and electrolyte therapy, there are a lot of objectives are there. Of course, we need to correct the extracellular fluid volume. Then also we need to correct the plasma pH. Then correction of the blood, what you call as this glucose concentration. Then correction of the plasma concentration of the specific ions, especially sodium and potassium. And also we need to select which type of the fluid is need to be selected, and what is the quantity of the fluid need to be administered, what is the route of the administration, and how much quantity I need to administer to a cow or the buffalo which we are going to treat. So these points we need to keep in mind very well. Then water is one of the most important vital, especially the fluid of the body, and the animal body contains more than 70% water by the weight. Suppose the animal is weighing 400 kg, then 280 kg is of the water. And already we know that water has got several metabolic functions, especially it is required for the activation of the enzymes, ions, etc. Then dehydration causes the electrolyte imbalance, especially the sodium, potassium, chloride, bicarbonates, and the glucose, and which causes the hyponatremia, hypokalemia, hypochloremia, acidosis, metabolic acidosis, or the acidosis, and hypoglycemia. So ultimately this will result in the peripheral circulatory failure, and hypovolemic shock is going to happen to the animal. Then electrolytes of the important electrolytes are here is potassium, calcium, then magnesium, sodium, and chloride. These are all the important ions or the electrolytes which are present in the extracellular fluid and also in the intracellular fluids. And whenever they are required, they are exchanged through the cell membrane. So the clinical signs of the dehydration are dryness and wrinkling up of the skin, and the eyeballs will get sunk, then loss of body weight gain and muscular weakness is there. And of course, most of the veterinarians have recorded all these signs, and dry mucous membrane, oliguria, and many times the total anorexia is there. So in field conditions, the veterinarians are going to hold the fold of the skin and try to diagnose the case of dehydration. So what is the skin fold test? It's a very simple test, and in which the veterinarian pinch a fold of skin on the neck and pulls it out, and note that the number of seconds the skin takes to return. As the time required to gain the normal position, then the concentration or the amount of the dehydration goes very high. So it is one of the important or significant tests to assess the degree of dehydration, as it is very easy to conduct in field condition. So the measurement of this test can be done by observing the retention of the skin fold for per seconds, how many seconds, etc. 1/2 to 1 second is normal actually. So we are going to held the skin, especially the neck region, and we will leave it back, and how much time is taken is going to judge. So we are going to assess the degree of dehydration, which is a very critical for deterioration of the fluid and electrolyte loss. Suppose the degree of dehydration is 4 to 8%. That's called as the mild degree of dehydration, and the eyeballs are not sunken, and the retention of skilled folds are vacant. It is absent. Immediately it will go back to the original position and retain it there. Whereas if the degree of dehydration is 6 to 8, it's called as the moderate, and it is barely visible by the naked eyes. The animal's eyes is going to be sunken, and retention of the skin fold, it takes 2 to 4 seconds to go to the normal position, whereas it is 8 to 10 seconds, or 8 to 10%, it's called as the severe dehydration, and the eyeball is sunken to a greater extent, and it takes 6 to 10 seconds to go to the normal position. And of course, this is a very severe type of the dehydration. So whenever there is a percent degree of the dehydration is about 10 to 12, then we will have the animal with shock condition, and it is very, very pronounced. Sunken eyeball, we can see that the eyeball is sunken into deep, and it takes long time, 20 to 45 seconds, to retain the, especially skin to its original position. So the loss of the body in water, as it go on increasing to percent, this is which is indicated in the particularly the earlier chart, and 0 to 4% will not get any type of the clinical signs, whereas if it goes to 2 to 8%, then depressed animal will be depressed, and if it goes 6 to 10%, then critically the animal will be ill, and immediately it requires the intravenous fluid therapy followed by the oral rehydration therapy. And if the dehydration goes more than 12 or 14, the animal will be found dead most of the time. And types of the fluid depends upon the type and extent of the fluid losses which is incurred, especially in case of diarrhea and severe what you call as this diuresis, then we can find lot of dehydration, and depends upon the state of hydration, electrolyte imbalance or balance, acid-base balance, renal function, etc. So the balanced crystalloids, or they are also called as this replacement fluids, are preferred in the replenishing hypovolemia, which is going to be reduced to a body fluid is going to be reduced, and the dehydrated state will be having a lot of abnormalities. So for long-term therapy, the maintenance solutions are preferred after rehydration, and it should be done by the maintenance therapy is by oral rehydration therapy is always required. And hypertonic crystalloid solutions is it's usually 7.5% saline solution used in certain types of the shocks, varieties type of the shocks. So how much quantity of the fluid need to be given? This is a very important question from the field veterinarians, and it depends upon the maintenance need, deficit, then ongoing loss, because as we go on administering some fluid, simultaneously there will be loss also. Hence, we need the treatment based on the 24 hours fluid replacement is equal to maintenance volume is needed, then deficit volume plus continuous loss volume. So this is the total 24 hours fluid requirement is there. Whereas the maintenance volume means the amount of the fluid needed by a euhydrated or normal patient over 24 hours period. For example, in case of the adult cattle, it is 60 ml per kg, and especially, and in case of the neonates or the calf diarrhea or calf dehydration, it is 130 ml per kg for neonates in all the species, including the human being or maybe the dog, cat, or whatever it may be. So a lot of such things are there. Then the amount of the deficit volume, how it need to be calculated is amount of the fluid that has been already been lost by the animal during the disease. Maybe the diarrhea is one of the most important cause. So the deficit volume is equal to estimated percent of dehydration. So by the naked eye also we can make it into ml into per kg into body weight into 1000. That's the deficit volume we can calculate. So the rough assessed from the physical parameters such as the body weight, then skin turgor, or it is turgor means the pressure exerted by the fluid in a cell that presses the cell membrane against the cell wall, and also the pulse rate, capillary refill time, etc. So this is also again, as I already told, it is hypertonic, isotonic, and hypotonic, maybe the turgid. Then the estimation of dehydration is done by the physical examination finding less than 4%, the animal will be totally normal. And 4% is a very mild to or mild type of the dehydration, and there will be history of omission or diarrhea in case of the animals other than that of the ruminants. But no significant loss is there, and usually higher type of the dehydration will be present in ruminants. 6% mild to moderate. The skin is leathery, skin is lifted, will peak, but returns to the normal slowly. Oral mucous membrane is seen dry, but tongue is moist. So this is 6% dehydration. And 8% the clinical signs, or it's also called as the moderate to severe dehydration, then loss of skin pliability and elasticity. Skin when lifted will peak and stay, and both mucous membrane and tongue are dry. And in the lower type of the dehydration, the skin will be usually wet and moist, and slow capillary refill time is there. Then severe dehydration is 10% and above. All the previous signs which are seen here, the extremities will be too cold, eye will be sunken, weak and rapid pulse is seen, then difficult to stand or downers, and moderate to marked mental depression is seen. Whereas in case of this higher dehydration, maybe 12% or more than 12%, all previous signs will get worsened, animal lying down and on its side and in shock condition. Usually the animal is found dead when the dehydration goes more than 12%. Of course, it is sometimes may be difficult to judge whether it's a very mild or moderate, but we can easily diagnose the 10% or severe.
Yes, I think there is some audio issue.
Yes.
So we'll please stay tuned. We will sort it out.
Yes, yes. We'll resume again soon. Yeah.
Please stay connected.
Please stay connected. Yeah. And I request all the participants, you can ask your question in the Q&A, this chat box. You can put your questions so that we can address it once the session is over. Dr. Sridhar, your audio is not clear. Dr. Sridhar?
Hello, am I audible now?
Yeah, it is audible now. You are audible now. Yeah.
Okay,
In
okay.
between there
Yes,
there is
happens.
connectivity loss.
Yes, yes. Okay, okay. So ongoing fluid loss will be calculated, and it is usually not a normal thing, and loss due to the continuous of the fever. So in fever also, because of the perspiration is more and suppose there is what you call as this hemoprotozoal disease, then also we'll get lot of dehydration is there. And fluid loss in case of small animals may be due to the vomition, but in case of the large animals it is not. Then the route of the administration. So varieties of the routes of these administrations are there. Of course, the oral, subcutaneous, intraperitoneal, intravenous, rectal, and intramedullary routes are there. So the oral route is most convenient for the small animals and neonates, whereas in case of the ruminants, we need a rumen pump because we cannot make the animal to hydrate by the drenching, and not suitable for conditions like unconsciousness. Directly it will go to the what you call as this airways and get this problem. And hypovolemic shock and the persistent vomiting may be there. And this oral fluid replacement therapy, especially in the cows, require the rehydration for the cows. Sodium chloride 155 grams, potassium chloride 50 grams, calcium propionate 16 gram, and magnesium sulfate 7 hydrate. It's so 4 gram is required. Whereas suppose the animal is suffering from this metabolic acidosis or rumen acidosis, then you can go for the 200 gram addition of the sodium bicarbonate, and this need to be dissolved in 20 liters of warm water intended for the dehydrated cows. So the 600 kg animal requires the 20 liters of this type of the liquid. And acute rumen acidosis, of course, we need to administer the sodium bicarbonate. Then in chronic ketosis, secretion of antidiuretic hormone is inhibited by a very high concentration of cortisol. So in consequence, the excretion of the water from the kidney is increased, and it is absorption from the intestine is reduced. Hence, the animal will suffer from more and more dehydration. Hence, this is called as this Ager's cattle pump, and of course, many times this is available in the Amazon, or you can get such type of the pump, and you can use this type of the pump. Allows one man to deliver 20 liters of the fluid into the rumen in just 2 minutes. So one can purchase this type of the pumps, of course, available in the Amazon.com. And a combination of 200 gram of sodium bicarbonate and 110 gram of magnesium oxide given with the 20 liters of the water into the rumen has been reported to be very good. So in this formula, you can add the sodium bicarbonate, especially in case of the acidosis, and administer it through the Ager's cattle pump. And of course, this is one of the easy water drenching technique, especially many times whenever the animal is suffering from the acidity or maybe due to the plant toxicity, and many times of the toxicity. This is one of the best method. Here in most of the farmers' house, we will have especially the pump is there or the tap is there. Then we can connect one end of this, particularly this pipe, to the tap, and slowly allow the water to go inside the cow's mouth. And we should never raise the mouth of, especially head of this cow, more than 45-degree angle, or else it will directly go to the lungs. And 1 or 2 days, if you train the owner, and we can easily make the cattle to drink about 50 liters of the water at a single time. And many times, without any type of the treatment, most of the cows will get rid of the dehydration. Along with that, you can also administer certain oral rehydration therapy powders. And intravenous route is one of the most quickest way to replenish the extracellular volume and preferred route of the severely dehydrated animal. And of course, this subcutaneous route is large quantity of the fluid cannot be directly administered, and it's not suitable for hypertonic, irritating solutions and severely dehydrated animal, because in case of severely dehydrated animals, the fluid circulation is very, very less. Hence, it is not suitable. And intraperitoneal route is one of the useful for dialysis when IV and subcutaneous route, and not feasible for the what you call a severe dehydration animal. And especially hypertonic solutions should not be administered intraperitoneal. And intramedullary route, a rare route, but whenever all the other routes may fail, then this may be useful. And here routes of the administration is oral route. It's very easy and safe and less rapid absorption is there. Of course, very severe dehydration cases, we cannot try this. Subcutaneous, of course, I already told that absorption is taking place much time. Intravenous, very fast, precise amount is given, available rapidly, then various tonicities of the fluid can be restored very, very fast. And possible fluid overload may also happen because of this thing, and expertise required, especially who can stand by the side of the animal. And require the close monitoring must be, all the fluid must be very sterile. And intraperitoneal, of course, there is a chance of infection is there, then cannot use hypertonic solutions, and it can be used. IV access is not at all possible whenever you cannot get any vein because of the severe dehydration. And rate of administration, how much quantity of the fluid need to be administered. This depends upon the severity of the dehydration. We cannot make any general line of the or the dose of this thing, but it depends upon the severity, whether 4%, 5%, 10%, etc. So initially, in case of severe dehydration, we need to administer 50 ml per kg per hour. Maybe I'm going to tell what are all the types of the liquids need to be administered. And less severe cases, about 60 to 80 ml per kg per hour in case of the shock. In all cases, we need to administer 5 to 15 ml. Please note down 5 to 15 ml per kg per hour after first hour. Of course, this is a practically little different, because if you administer the liquid little fast, then it may cause the cardiac overload and it may cause the cardiac dysrhythmia and stoppage. So usually if you put a cannula to the ear, that may be the better, but of course the controlling the cattle is also a difficult task. And we can insert the 18 gauge needle, and there are very special needles are available, and put a bandage to avoid slippage and separate the injection port from the skin surface, and we can slowly administer the required quantity of the fluid. And normal hydration indicated by the production of the urine. That's the positive indication for the what you call as this fluid replacement therapy. And urine production over 1 ml per kg per hour indicates over infusion. Then it need to be stopped. And urine output not established after 4 hours, then rate should be slowed to 2 ml per kg per hour or less till renal function is established. Whenever the kidney is not functioning, then we should be cautiously administer the fluid. And types of the fluid. This is the, what are all the types of the fluid? There are 2 types of the fluid. One is crystalloids and colloids. The crystalloid fluid is a water-based solution with small particles osmotically active in the body fluids, and they can pass through capillary membrane. They are called as the crystalloids, whereas the colloidal fluids contain large particles that cannot pass through the capillaries. And the crystalloid solutions are used, the examples are sodium-based electrolyte solutions with or without glucose in the water. And these provide water, electrolyte, and some cases the alkalining agents, maybe sodium bicarbonate also. So these are effective tools as replacement and maintenance fluids. So these type of the fluids have got long shelf life, inexpensive, easily available, and very less adverse reactions are there. That's the crystalloid solutions. So replacement fluid means mainly isotonic sodium based on fluid with composition similar to that of the plasma. They are called as the replacement fluids. And when given rapidly in large volumes, do not drastically change the constituents of the intravascular fluid. So the replacement fluids can be given little fast also. Then maintenance of the fluids, this substitutes for normal intake of the water and dietary electrolytes, and provide after initial fluid balance is restored. That's called as the maintenance fluid. So here, initially we need to treat the dehydration by replacement fluid and maintained by maintenance fluids. And parenteral crystalloid preparations are also available. They are also called as saline solutions or sodium chloride solutions. It's usually 0.9% weight by volume sodium chloride in water, or they are also called as normal salines. And these are most widely used replacement fluids, slightly acidic in nature and contains about 300 milliosmoles per kg of the fluid. And extracellular fluid contains 2/3 distribute to interstitial space and rest remains the intravascular space. Hence, these are very much required for the replacement therapy. And usually these are used for the irrigations of the body cavities before the operations or after the operations. And the dose should be given as 40 to 50 ml per kg per IV, slow IV, or sometimes subcutaneous, or sometimes IP, because these are not irritant in nature. Whereas the hypertonic saline solutions are available as 3%, 5%, or 7.5% sodium chloride in water. And these are indicated in different type of the dehydration. They should be only given by IV route, no other subcutaneous or the other route. And one should always avoid the rapid IV injection, and because they result in vaguely mediated hypotension and bradycardia. And dose is the 5%, 6 to 10 ml, 7.5%, 4 to 8 ml per kg per hour. Then hypotonic saline solutions, they are usually half of this normal saline, that's 0.45% weight by volume of the sodium chloride in water. So mainly used in case of the maintenance fluid. Then usually the half normal saline with 2.5% extosis fluid of the choice for patients with sodium restrictions, especially, and those who tend to develop hypernatremia. And other sodium chloride solutions are also available as 0.22% sodium chloride, and they are used for the maintenance therapy. And 23.4% solution is for traumatic brain injury. They are called as the hypertonic solutions. Whenever we find that there is a concussion in the brain and brain injury, immediately they need to be administered, because the fluid will get outside. And ringer solutions, you might have heard the different type of the ringer solutions are also available. Then the ringer solution is the prototype replacement fluid that contains sodium, potassium, then calcium and chloride and isotonic, and invented by Sydney Ringer. That's why there it is called as the Ringer's solution. And it is osmolality is 310 mMol per liter, and high chloride content has no precursor of the bicarbonate in the simple Ringer's solutions, and it is used as the maintenance fluid. And this contains the sodium chloride, sodium bicarbonate, potassium chloride, sodium dihydrogen orthophosphate, calcium chloride, and glucose in different concentration. Then the compositions of the Ringer solution is like this: sodium chloride, calcium chloride, potassium chloride, and also the glucose and varieties of the other constituents. Ringer solution. So dose is usually 40 to 50 ml per kg body weight per day. You can see that per day. This is total dose. Lactated Ringer solution, or it's also known as Hartmann's solution. So this is the Ringer solution containing additional lactate, which is also a precursor of the bicarbonate. And here you can see that this is a normal composition of the Ringer solution, and here this is containing the lactate. That's why it's called as the Ringer's lactate. And Ringer's lactate is containing the lactate in the form of, and ultimately it is the pH is maintained at 5 to 7, little towards acidic solution. So the Ringer's lactate, ideal replacement fluid with plasma-like electrolyte composition, volume expansion or plasma volume expander, and replacement of the fluid deficit, and fluid delivery for the reversal of all types of these shocks, maybe due to the septic shock or due to the hypovolemic shock and male. So cattle 90 ml per kg infusion for replacement therapy. And it is especially useful in case of the acidosis conditions, maybe rumen acidosis and metabolic acidosis. So that is important indications of the Ringer's lactate. Of course, this acetate Ringer's lactose is also available and it's containing sodium acetate. And instead of sodium lactate, sodium acetate is present in case of the acetated Ringer's lactate. And it is useful in case of the metabolic acidosis. And dextrose solutions, different type of these solutions are available with different type of the, so dextrose 5% is dextrose is useful in case of hypernatremia and primary water depletion. And also carbohydrate resource, especially the dextrose and cattle 40 to 50 ml per kg. And you can calculate, it comes a very huge volume. And hypertonic dextrose solutions 10%, 25% and 50%. Of course, these are used by the field veterinarians as 400 to 8 ml as total, slow IV or sometimes subcutaneous. No other route of administration is required. And hypertonic 2.5% dextrose. Whereas the isotonic contains 4.3% of dextrose plus 0.18 sodium chloride. It's also known as dextrose normal saline solution. Other dextrose solutions are hypertonic 20, 30, 40, 60, 70% with that of the Ringer's lactation. And sodium bicarbonate solutions are also available for the sometimes isotonic solution 1.5%. Then alkalize the urinary alkaline, but there should be one caution is taken. Administration to be done very slowly to prevent the overshoot of the alkalosis by reflex mechanisms, and it should be given as the 2 to 5 milliequivalents or usually 2 to 5 ml per 4 to 8 hours is very much required. And potassium solutions are also used as potassium chloride, and only one caution is these solutions need to be administered very slow IV at the proper dose, or else they may cause hyperkalemia. Then potassium phosphate solutions, yes, mixture of these monobasic and dibasic forms, and whenever they are to correct the hypokalemia or hypophosphatemia, these solutions can be administered. And very popular solution is calcium borogluconate, and very commonly these are used as the calcium salts. Of course, these are the doses of 0.5 to 1.5 grams of the calcium subcutaneous or IV, or simply what we can say is 1 ml per kg slow IV. And calcium chloride, of course, this is a little caustic, but now the most of the fluid replacement therapy, especially calcium deficiency, is being treated by calcium magnesium borogluconate. And of course, we have got calcium lactates and many more. And magnesium sulfate is also used as the adjunct along with the calcium borogluconate, or it's also called as calcium magnesium borogluconate, and you can see the combination on the slide. 1 gram of magnesium sulfate supplies 8.5 milliequivalents of the magnesium, and this is also used for the combined therapy of calcium and magnesium deficiencies. So usually the cattle, they require 200 to 400 ml of this calcium and magnesium content, and subcutaneously followed by slow IV. It need to be administered, or else the animal may collapse also. So this another solution is called as Darrow solution. So it is also called as lactated potassium saline, and consists of 0.4% sodium chloride, 0.7% potassium chloride, 0.58% of the sodium lactate. So potassium rich, potassium deficiency, potassium chloride deficiency, then it is not used for the initial restoration of extracellular fluid volume in case of the diarrhea. And last but not least, we have to go for the oral fluid replacement, and it's one of the most safe economical means of the fluid administration. Then it is very much required whenever there is a intestinal co-transport of the sodium and glucose, leading to the increased water uptake and reversal of the rehydration. Usually the oral rehydration therapy should be followed by the IV rehydration therapy, because the potassium is present, then calcium is present, and many more time. The colloid solutions also, they may require in treatment of different types of the dehydrations. So this has required some of the points is which require hypovolemic shock and hyperproteinemic and other type of the shocks. We require such type of the solution. And lastly, the dextrons or dextron 70 and 40. These are complex polysaccharide molecules obtained from the action of this leuconostoc, this especially mesenteroids, and especially this bacteria is going to produce this type of the iron dextron is prepared, and dextron 70 is most commonly used in veterinary medicine, followed by this dextron 40. Of course, these have got different pharmacological profiles or the pharmacological effects. Whenever there is a totally this blood is lost, then they can have the replacement therapy, but cannot totally replace the blood. And some of the side effects, they have got anaphylactic shock many times, these dextron preparations. And especially the dextrons should not be given whenever there is a coagulopathic or severe anemia is there, then there is a toxicity of anticoagulant rodenticides and should not be indicated in case of a certain shock. Especially it is can be used in case of hypovolemic shock occurs due to the severe what you call as hemorrhages. The dose of this dextran preparations is usually 10 to 20 ml per kg per day. IV infusion not exceeding 5 ml per kg. Very slowly we need to administer this term. And hetastarch, it is also called as the hydroxyethyl starch, a synthetic complex mixture of ethoxylated amylopectin, various molecular sizes. So this 6% HEA solution or 0.59% sodium chloride solution can be administered to that of the dextron, iron dextron, and dose is 10 to 40 ml. And another solution, oxypolygelatin solution is also required, 5% gelatin solutions. So the indication is anaphylactic shock, and sometimes this itself may cause anaphylaxis and one need to use. Then polyvinyl pyrrolidine solutions have got the what you call as this molecular weight of 30,000 to 50,000 Dalton, though so very rarely they are used in certain situations. And hemorrhage and blood, the type of the fluid therapy is required is the Ringer solution, sodium chloride solution, followed by isotonic solution. Whenever there is a heat stroke, so now in the summers heat stroke may also occur, then the disturbance is the free water loss, and the required fluid is normal saline, it's the 0.45 solution or hypoosmotic, and dextrose 2.5 followed by the sodium chlorides or Ringer lactate. And severe burns, the plasma volume expanders or the dextrans preparations or Ringer lactate is there. If in case of the dogs, if vomiting is there, then always Ringer Ringer solution simply, then sodium chloride is required. So suppose there is a severe diarrhea in case of ruminants, then the Ringer lactate solution 20 to 30 ml per ml per hour may be administered. Anorexia, sodium chloride 0.18%, then dextrose 4% or dextrose 5% may also be required. And in case of the ketosis, then 50% dextrose solution initially, followed by 5% dextrose solution or glucose, or the glucose precursor by mouth like this glycerin and etc. may be also be given. And the bowel obstruction which happens in sometimes the cattle, and at that time plasma volume expanders plus Ringer lactate is required. And the most of the time this hypovolemia, then the normal volemia and hypovolemia need to be treated with different type of the treatment, and here we need to concentration on the hypovolemic shock. So ultimately the last slide, this is the type of the fluids that need to be administered like dextrose 5% in case of this fluid loss, and it can cause fluid overload if you administer very fastly. Isotonic 0.9% sodium chloride, and it is indicated in case of the shock and hyponatremia. Then also it is used in case of certain dehydration, blood transfusion, and sometimes it is need to be taken care that sometimes it may lead to overload and cause the shock. And isotonic fluids, the Ringer's lactate is always a isotonic fluid, and it contains potassium, and never use it with renal failure, and don't use with liver diseases, especially the isotonic, this lactated Ringers. And hypertonic solutions like this hypotonic solutions 0.5% sodium chloride. So this is indicated in case of a water deprivation syndrome, and it need to be used with caution and may cause cardiovascular collapse also. And always we need to take care that they should be very slowly administered. And hypertonic, any percent, it's a dextrose 5% or more, then so this need to be used with caution only when blood glucose falls, sugar falls below 250 milligram per deciliter. Hypertonic solutions of this glucose need to be used in case of temporary treatment of shock if plasma volumes are not available, plasma volume expander like iron dextrons. And this should be used with caution that cardiac and renal patency should be there. And dextrose more than 10% in water should be used as water replacement therapy. Then one need to also can be administered where some nutrition with glucose is very much required. And at that time, blood sugar level need to be this normally, it should be monitored. And of course, these need to be taken care. And here, of course, this can be supplemented, especially usually the too much type of the dehydration may be supplemented with Rintos, which already a ready to use solution is available, and many companies produce such type of these fluids, which contains a 20 gram dextrose, 100 ml contains 20 gram dextrose, sodium chloride, and 0.6 gram of the sodium chloride, potassium chloride 0.04 grams, and calcium chloride 0.27 grams. And of course, sodium lactate is also available, so that this becomes a balanced solution which can be used in many type of these solutions. And this can be followed by any content which is having the oral rehydration therapy indicated for the oral rehydration therapy, just like this Ringer's Beta Oral, which is a feed supplement enriched with varieties of such type of the contents. And usually initial dehydration need to be maintained by this Rintos, etc. Then it is need to be followed by the oral rehydration therapy. So this can be done. And many companies we have got, and each veterinarian can his own choice for this. This is just a suggestion. What can I say? And with that, I thank the organization, especially Vetoquinal, and all organizers for giving me the opportunity for having this, especially this webinar. And of course, it was the lengthy presentation was there, and hope many questions are also with us. And thank you very much for this, especially giving the opportunity. Thanks a lot.
Yeah, thank you so much, Dr. Sridhar, for your informative and elaborative discussion on this particular topic, fluid therapy in veterinary clinical practice, which looks a very basic topic, but it has a lot of that things to discuss. And majority of the doubts which you explain in a simple way, most of our doubts has got clarified. Even I could read the participant feedback in the chat box. So they said that It was a very informative discussion, and they are also requesting for the presentation. So now, once again, I thank you. But now it's a time to take a question and answer, which we have received from the participant.
Yes.
Dr. Sridhar, can we take a few of the question and answer?
No problem, no problem.
Yeah. Okay. So the first question which we received is that which fluid is recommended in toxic shock?
Shock.
Yeah.
No, once again, the shock is so many types of. It is like a hypovolemic shock, or sometimes this too much what you call as this endotoxic shock. Many types of the shock are there, and we need to select a particularly the solution. But usually the 20% dextrose with that of the normal saline can be used in case of the shock, and in case of acidic induced shock, especially the fluid overload and other things, Ringer's lactate can be used at the dose rate of 50 to 60 ml per kg per hour, and of course it need to be administered very slow IV. Later it need to be followed by the oral rehydration therapy with the available fluid supplements, sir.
Yeah. So toxic, it's a shock means it is a highest degree of dehydration.
Yes.
It is highest degree. It is a very severe type of dehydration which requires that aggressive type of the fluid therapy. Thank you, sir, for that answer. There is one question from the participant that whether Ringer's lactate is contraindicated in acidosis.
Actually, Ringer's lactate is very much required in case of the this acidosis, which is usually induced by the overload of these grains, which happens due to the overeating up of the rice. Sometimes the wastes of this, especially the engorged carbohydrates, many times the animals are going to eat some fluids, wherein with lot of lactic acid is produced. At that time, it is not so contraindicated. Of course, we can give. It is recommended as per the literature. The lactate is going to convert it to the bicarbonate, and in such a way that it neutralizes the acidosis. It is not contraindicated.
Yes, sir. It's indicated, and what we understood is that this after metabolism in the body, this lactate get converted into the bicarbonate. That helps to manage the pH at the blood level.
Yes, sure.
Then there is one question is that what is the best treatment in case of ruminal acidosis and alkalosis? These are the two different conditions. One is acidosis and the alkalosis. What is the best treatment to be done along with the fluid therapy?
So ruminal acidosis usually caused by the overload of this grains or any carbohydrate rich thing. Am I audible now?
Yes, sir. Yes, sir.
Okay. My video is somehow hanged.
Yes.
Okay, in such case, right? Whereas in case of the ruminal alkalosis, maybe due to the urea poisoning, or sometimes maybe due to the what you call as this especially some organic or inorganic this thing, especially in case of some manure poisoning. So at that time, it may be too much alkaline in solution. So at that time, this sodium chloride, or sometimes it's hypertonic saline solution, or the osmotic solutions can also be used. But the thing is, we need to administer them slowly, maybe 4.5% or sometimes 0.45%, or the normal saline. If the condition is too severe, then we can go for higher concentration of the sodium chloride or the hypertonic saline solution, sir.
Okay. Thank you. There is one question from the participant that whether oral rehydration therapy really works in animals.
Oral rehydration therapy really it works, especially in case of the animals, but it need to be followed by always IV or the IV fluid rehydration therapy, or else it may not work very properly. Hence, usually such type of the therapy is required in case of oral. This thing is very much required, especially in case of the ruminants, because we cannot substitute the entire quantity of the fluid by the intravenous rehydration therapy. Hence, it need to be followed by oral rehydration therapy only.
So it means to say, sir, that IV therapy should be given first as an hydration therapy, which will help to that increase the osmolarity and immediate replacement of the fluid balance. And
Yes,
once the
correct.
animals start drinking the water after IV therapy, then we can shift that particular case to the
Yeah.
oral rehydration.
Sure,
That way
surely.
it
The
can be.
acute condition need to be treated by IV therapy only. Then it need to be followed by the
Yeah.
oral rehydration therapy.
Because we understand that also while working in the field that there is a requirement of 30 liters. So IV we cannot even replace with the 30 liters. So we give IV therapy followed by the oral rehydration supplement.
Surely, surely. That is very much required.
Yeah, thank you for that answer. Then there is one participant who has asked about the currently the summer is going on. What are the important, that how to diagnose the cases of heat stroke in case of the large animal?
Especially the heat stroke is usually followed by the animal is unable to get up, then the eyeballs will be sunken, and it is sometimes the anorexia may also be seen. The animal is dull and depressed, and usually it is going to be followed by the history of this exposure of the animal to the too much hot or the heat. That may be also one of the things, and accordingly we need to treat them with the IV fluid therapy followed by the oral rehydration therapy. It's very much required.
Okay. So which type of the fluid which a veterinarian should prefer in cases of, that large animal suffering from high fever? What is the recommended fluid when the
Usually this in case of the animals with high fever, dextrose normal saline is required because there is a deficiency of the glucose. At the same time, this hypovolemia may also be there, and the animal loses a lot of what you call as fluid from the respiration. So at that time, there is a chance of this metabolic alkalosis also there. So this thing can be combated with that of the sodium chloride, and the dextrose or the energy supplement is required with that of this dextrose normal saline is the recommended line of the treatment there.
So which fluid should be preferred in case of the anemic patients? So those who are having that decreased red blood cell count as well as hemoglobin count, which fluid to be recommended, and what is the volume of the fluid can be given in such cases?
Especially this is true in case of this anaplasma, thalaria, and babesia. As soon as we start giving the fluids, many of the animals are going to succumb to die. This is not due to the what you call as this fluid itself. Many times they say that it is due to the severe anemia. But in case of such type of this, especially anemia, which is due to the especially thaliasis or anaplasmis, we need to administer the diuretics. Of course, with a lot of caution, we need to administer the diuretics because there lot of fluid will be accumulated in the lungs and there will be pulmonary edema there. So initially, we need to administer the fluids, especially these diuretics, followed by the dextrose normal saline or any others what you call as this Ringer's lactate, depending upon the type of this, especially the anemia. If it is too severe, then we cannot go for the Ringer's lactate. It need to be maintained by dextrose normal solution or the osmo, what you call as this normal saline solutions, which need to be maintained. Dextrose normal solution is better in case of other thing. Or else, if you use these hypotonic saline solutions, then there is a chance that the animal may go for more anemia. That's also another choice is there. Okay. The better type of this solution is osmotic saline solution or dextrose normal saline solution, sir.
Okay. So how to diagnose the cases of hyponatremia and hypokalemia in field condition? Is there are any typical clinical signs that animals they demonstrate when they are suffering with hyponatremia and hypokalemia?
Whenever there is a diarrhea, both type of hypokalemia and hyponatremia is there. Especially, of course, in case of too much regurgitation of the fluid, especially in case of this metabolic or the ruminant acidosis, then that may be this thing indicated by hyponatremia. Whereas in case of hypokalemia, is a very common thing in case of the diarrhea. So, and whenever there is a fluid, especially this overgrain or overfeeding of the grain, then at that time hyponatremia may be there. But in case of diarrhea, both hyponatremia and hypokalemia are the characteristic fluid losses are there.
Okay. Okay. There is one question from the participant, no, Satish, that can we give fluid therapy in pneumonia?
No, fluid therapy is not indicated in case of pneumonia, because there is already the heart is what you call as heart cannot pump more and more. Pneumonia, usually whenever we administer any type of the fluids, directly it goes to the lungs. And after going to the lungs, then once again it get purified there, oxygen and the carbon dioxide get exchanged there, then it comes back. But in case of this cardiopulmonary problem is there, then usually the animal is going to die, and we need to administer the fluid with very slowly and with prior administration of sometimes the diuretics. If it is very much required, it's unavoidable sometimes. So at that time, prior administration of the diuretics, leave 1 or 2 hours and start the slow administration of the fluid. That's very much required in such cases.
Okay. Thank you, sir, for that answer. There is also questions from the participant that what kind of the injections that we can use along with the IV infusions, means how many, that how to add antibiotics, or can we add more than 2 in, injections in one IV fluid?
No. Multiple drug administration is not indicated in case of IV fluids, especially I can say that Rintos, etc., which contain varieties of types of these electrolytes, etc. When usually some of the solutions which only one, especially this, especially B1, B6, and B12, they can be put inside the IV, and more than 2 injections are not supposed to be put in case of any type of the fluids. That's very much we have to take care. And sometimes if it is getting curdled, if you administer many type of sometimes some veterinarians have got the habit of administering many type of the injections in the same type of this particularly the fluid. That is not recommended actually. It has to be administered as per the manufacturer's recommendation only. Maybe if they say they're subcutaneous, administer subcutaneous. If they say IV, then administer slow IV only. Never mix, especially the multiple electrolyte containing fluids. Very simply, maximum 2 solutions, and you have to check this pH. If they are not incompatible, then you should not administer multiple type of the drugs in especially the fluids. That's not indicated. Drug interaction may happen in vitro also sometimes.
Okay. So you mean to say that it may be disturbs the osmolarity of the or ionic balance of the that electrolytes.
Surely it happens.
The IV infusion. So there is one question again that which fluid to be used in coliform mastitis when the dairy animal is suffering from coliform mastitis. So what kind of the fluid to be preferred?
That is preferred is dextrose normal saline is preferred, both because in case of coliform mastitis, lot of endotoxins are released there, endotoxic shock is there, and there is hypovolemia is there, and at the same time lot of glucose deficiency is there. So the better choice of the fluid is, and if there is too much diarrhea is there, then you can also go for this Ringer's lactation. But the preferred fluid, I think it is usually this dextrose normal saline if there is no diarrhea. But if there is too much diarrhea, then you can go for then Ringer's lactate.
Okay. So we are talking about diarrhea. There is also a question from the participant that can we use a metrogyl fluid in ruminant? Metronidazole, that is a metronidazole IV solution.
Metronidazole IV solutions are there, especially yes, they are the pharmacology of that metronidazole. It's a imidazole derivatives, especially if it is effective against gram-negative anaerobes. But the thing is, usually the penetration percent to the, especially in case of this intestine, is less when compared to if we give it orally. But in case of ruminants, what happens is usually most of the time the ruminal microflora are going to degrade this metronidazole. So usually that is not so what you call as effective in case of the ruminants other than that of the oral route. And once again, the efficacy is questionable because the quantity that we are going to administer is very, very low. And if you administer more quantity, it may end up in toxicity also. That's why this IV administration of the metronidazole or intrauterine, of course, it should never be administered with any other type of the drugs. Of course, many intrauterine preparations are available. And as a pharmacologist, I can say this thing, and we require a lot of research on this thing. At this stage, it's too primitive to recommend whether the IV can be given, not given, etc. And number one, the quantity what we administer is less. Number two, the concentration that is arriving in case of the intestine is also less. And also the uterine quantity which is coming inside the uterus is also questionable. Hence, I cannot give you any clear-cut answer in this case is concerned. The study is required.
Okay. Thank you for your comments on that. There is also a question from the participant that, sir, how much fluid we can give through subcutaneous route? How much total amount of fluid which we can use by subcutaneous route?
No, we should not give more than half liter or more than 250 quarter liters of the fluid subcutaneously, because if the animal is having less dehydration, then subcutaneous route is maybe administered. But if it is having more and more, this was especially the hypovolemic shock, etc., cannot be treated with the subcutaneous administration of the fluid. And subcutaneous administration of the fluid, there are disadvantages that it causes a lot of pain to the animal. And also, if it is the animal, if it is in the too much dehydrated condition and it requires the immediate fluid replacement, then subcutaneous fluid cannot be administered. Usually, primarily, we have to go for the IV route of the fluid, followed by the subcutaneous route. Whenever the dehydration is already compensated by the IV route, then just to that addition to this oral replacement therapy, we can add the subcutaneous route, and not more than 250 ml is not required. They administered at a particular slide, maybe left or right, and we can make 125 ml. Suppose it's a calcium borogluconate or maybe the Ringer's lactate or any other thing, 125 ml at the same time, or else it causes sometimes the irritation or cellulitis at the site of administration, and sometimes this brisket edema may also happen because the fluid gets detention or retained out.
Okay. Correct, sir. Then I will take next two questions, because still we are receiving many questions. Maybe
Okay.
our time, according to our time, we can also answer them afterward. But two questions I will take. It was related to the metabolic diseases. Which fluid should be given along with the calcium therapy? If somebody want to treat hypocalcemia, along with that, which that fluid a veterinary practitioner can?
Better is dextrose normal saline along with this calcium, because calcium borogluconate itself is a hypertonic solution, and sometimes it may be administered with that of this magnesium chloride also. So if you want to take care of these conditions, better to go for the dextrose normal saline with the dextrose solution. Or simply we can also go for, because this calcium borogluconate itself, it contains this what you call as this glucose, then you can also go for simple normal saline solution also.
Okay. So in case of there is next question in the similar line, in case of the ketosis or hypoglycemia, how much quantity of the dextrose to be given? Is totally in liter, and for how many days?
It depends upon the percent of the dextrose solutions. If it is available as a 20%, just like your Rintos, it is there, then usually maximum 2 to 3 bottles or 2 to 3 liters, what I can say, that is a better, and it need to be followed by the oral supplementation of the rehydration therapy. Oral rehydration therapy is required, and also the glucose supplementers like this what you call as this glycerin, etc., they need to be administered in case of the bovine ketosis. If the bovine ketosis is once again complicated with that of the dehydration, and you have to treat it with the depending upon the type of the dehydration, whether it's 4%, 6%, etc. Usually the 1 to 2 liters of 20% dextrose solution is sufficing.
Okay. Okay. Then there is a question that what are the signs of rehydration? Means animal is treated for dehydration. So what are the improvement signs? What are the signs of rehydration in animal?
The animal, after half an hour to 1 hour, it starts urinating. The animal starts urinating. That is the first indication of the successful oral rehydration or successful rehydration therapy. The animal starts urinating. And if it's not at all starting the urination, then we have to think that whether the animal is suffering from some of the kidney disorders. Usually after half an hour to 1 hour, the animal starts this urinating. That's the better indication. And the sunken eyeballs, etc., they reset, and the skin positions, the skin structures, etc., they will improve after 1 hour to 1.5 hours of the fluid replacement therapy.
Thank you so much, sir, for your that detailed discussion on this topic, and that we could be able to clarify most of the doubts from the participants. And there are a few questions which we can take through email. We will answer that questions and email to all the participants. And there is also a request from the participant to share some of the presentation slides that we can check with you, sir. And sir, for your information, as a Veticanol, we also work on the that campaign that complete the journey from that dehydration to rehydration, because Veticanol India has that one of the renowned product, that is the Ringtos. Recently, we have celebrated the 40th anniversary of the Ringtos. We generally consider Ringtos as an hydration therapy, and it is also we have Ringtos Beta Oral, which we that recommend as a maintenance supplement for oral rehydration after the as a follow-up therapy. Once again, I take the opportunity to thank you, sir, for the detailed presentation. Now, with this, I request Mr. Anjan Kumar Das to present the vote of thanks to all the participants.
Thank you, Dr. Vijay. First of all, good evening to all participants. I think we have almost 1.5 hours. It is over. So, thanks to Professor Sridhar, who was the speaker for the day, and it was a really informative and very interesting session. And the beauty of the presentation was the recommendation of the different solution and the different dehydration cases, which was very elaborated, and many questions has come in this segment only. And as Dr. Vijay has mentioned, is that many participants have shown their interest on the presentations and the text of the presentations, which can be, we can help to the all participants to provide the information as they requested. Okay. And as mentioned by Dr. Vijay, yes, Vetoquinol has celebrated 40 years of the product which we have introduced in Indian market, and Vetoquinol is the leader in these fluid therapy segments. And we stand number one company in the country, and really appreciate and thank you to all the supporters, all the customers, those who have made the products and brands number one in the industry. And in behalf of Vetoquinol, I really thanks to all the participants for their participation. And I once again extend my sincere thanks to Professor Sridhar for this session. And thanks to Sales and Marketing Department of the Vetoquinol to make this program success. Thank you all, and have a nice time.
Thanks. I want to extend my heartful thanks to all the organizers, of course, Anjan Kumar, then Vijay Mulya, and my dear friend Dr. Sachin Raut, and all the other persons who supported me in this, and also given me the opportunity to have the interaction with different veterinarians from all over the India. Maybe more than 300 participants were there in the earlier stages, and I am extremely happy to be associated with Vetoquinol in the future endeavors. Thank you a lot, sir.
Thank you, sir.
Thank you.